Who knows? I was one of the stragglers coming in. Okay, so we're going to talk about urinary tract infections. All right, and I do have a slide presentation behind me, but we're going to kind of just, anybody who wants to interject, ask something, just feel free to do so. Okay, these are meant to be casual events. All right. Okay, urinary tract infections. I'm sure some of you in here have had a urinary tract infection, okay? I would say that probably at least maybe 10 or 20% of my patient list on a weekly basis are complaining or they complain about urinary tract infection or at least symptoms, okay? So it is a almost daily occurrence, okay? And it can be a life-changing event, all right? So, rates of urinary tract infections. For people over 65, especially females, okay, the rates are 10%. All right, so 1 in 10 people can get a life-threatening infection over age of 65. And then, in terms of the geriatric population, I like to use the age 80, okay? Here the slide says 85. 30% or more suffer urinary tract infections, okay? Now, treating urinary tract infections is very challenging, and identifying a urinary tract infection is very challenging. It's not as simple as ordering a urinalysis and taking a look at it and then going from there, okay? We have to remember that especially females, slightly different from males, that a large percentage of females are colonized with bacteria, okay? So just because you have bacteria in your bladder does not mean you have a urinary tract infection, okay? Why is this important in today's age? Is because we're over-treating urinary tract infections and causing resistant patterns, all right? We have now bacteria that are resistant to every class of antibiotics, okay? All right? We have fungus, okay, especially post-COVID era where we threw massive amounts of antibiotics to millions of patients with COVID. They're being super infected with a highly resistant fungal infection, okay? This fungal infection can stick with you lifelong. It's resistant to all treatments, okay?
Where is it in your body?
It depends. Okay, it can be in your. It can colonize in your urine. It can colonize in your bloodstream. Okay, it can colonize in an organ system. Okay, for example, it can crawl up into your kidney and sit there forever. All right, and antifungal treatment is extremely taxing to the body. Okay, I'm going to go to this next slide to kind of show the challenges. So, when we talk about urinary tract infections, I know this is kind of small. I don't know if you guys can read it, because for some reason you guys are way back there and way up here, all right? But there are two different types of urinary tract infections, uncomplicated and complicated. So what does this mean to you, all right? I know these are sometimes medical terms, but depending on how you guys present to me, I'm not saying you guys specifically, but patients in general, how you present can lean toward what type of bacteria is causing the urinary tract infection, okay? Why is this important? Because there are certain types of bacteria that have different resistant patterns. Depending on how you present, okay, the left side is mostly caused by E. coli, okay? The blue is E. coli. E. coli is a bacteria that you usually get from fecal matter, from stool, okay? So, especially females, how you clean yourself, okay, is important, okay? How often you use the restroom, how often you empty your bladder is important, okay? Again, it's a different conversation with males. E. coli has a different resistance pattern, okay, than, for example, Klebsiella. That's another bacteria. Now, depending on how you present, as you can see, this thin little brown sliver here represents 3.5%. So if you present a certain way, Klebsiella is a less likely bacteria, and it's E. coli more. So there's different antibiotics that treat these two bacterial infections. Now, if you present as a complicated way, meaning if you have fevers, flank pain, okay, elevated white count, if I check your labs, that means I need to be thinking about a higher rate of Klebsiella, higher rate of Pseudomonas, so on and so forth. So I know these are medical terms, but it's important for you to know that the treatment is different in terms of how you present, okay? Also, the etiology, meaning the cause of your urinary tract infections, is slightly different, okay? Males. We have two males here, okay? All right? When you get a urinary tract infection, how we treat it or how we think about it is different than females, okay? If I see bacteria in your urine as a male, most often I'm already assuming that you have an active urinary tract infection, okay? Females is different. If I see bacteria in your urinalysis, you may or may not have a urinary tract infection, okay? Males, okay? If you have recurrent urinary tract infections, all right, that I get concerned about prostate health, I get concerned about bladder function, all right? A totally different thought process than females, okay? So, if a male gets recurrent urinary tract infections, I'm thinking that something more serious is going on, okay? If I see blood in your urine, for both males and females, but more so males, I am more concerned about possible bladder cancer, especially in the geriatric population, okay? Okay, so the real highlight of this talk should be how do we prevent urinary tract infections, okay? When you get a urinary tract infection, the first couple slides were for you guys to understand my thought process, okay? What goes through my mind, it's not as simple as just writing antibiotics and kind of just say, see if you get better and go from there, okay? The big thing for you guys is how to prevent urinary tract infections, right? The one way that you can prevent urinary tract infections, especially in this environment, is hydration, okay? Out of all the communities that I've gone to, okay, and don't take this the wrong way, it seems like everyone here enjoys a glass of wine at night here, okay? I think 90% of my patients say, you drink alcohol. Oh yeah, 1 or 2 glasses of wine. Now we talked about wine intake during the last meeting, but from a hydration standpoint, okay, remember that alcohol is a diuretic, okay? You lose water, all right? You throw that in with the hot desert heat, okay, all right? You're going to run into issues of concentrated urine. Concentrated urine is filled with proteins, okay? What are the building blocks for an infection? Okay, what does bacteria love? They love a dark environment, they love a little bit of fluid, and they love to eat that protein for nutrition, okay? So what's the bladder? Dark environment, okay? You get a concentrated urine, boom, big protein load, building blocks for life for bacteria, okay? And you get a little bit of fluid in there, okay? And then you're off to the races in terms of infection. So the biggest thing for you guys is hydration. Now, to take this a step further, hydration does not just mean water in a warm environment, okay? If you drink massive amounts of water without salt or electrolyte intake, you're going to cause trouble, okay? If you find yourself sweating or losing water out in this desert heat, you need to drink water plus electrolytes, okay? So if you have 2 glasses of water, you need to drink a Gatorade or have electrolyte. They sell all these packets over the counter at CVS or Walgreens or even Costco. You can buy a whole box for $20, okay? You need to add those electrolytes in your fluids, or you're going to knock your salt levels down. Okay? One of the most common things I see in the emergency room, okay, out in the desert environment, is hyponatremia, meaning low salt levels. Okay? Hot day, person drinks a lot of water, they don't think anything of it, boom, next thing they know, they're confused, they're falling down, they have nausea and vomiting, and they're like, why, what's going on? I drank a lot of water. It's because you knocked your salt levels down because you did not hydrate appropriately. Okay? We talk about hygiene. Okay? All right? Females, how you clean yourself. Okay? Especially after a bowel movement. Okay? Sexual intercourse, okay, that's a big thing. Are you urinating after sexual intercourse? Okay, you're emptying that bladder. That's important, okay? All right. Medication review. A lot of people, NSAIDs, things like ibuprofen, okay, Advil, naproxen, okay? People get older, they have joint pain, they have aches and pains, okay? You pop a couple Advil to get your day started. Well, guess what? That increases your risk for urinary tract infections. Narcotics. Narcotics slow down the squeezing function of your bladder, so urine sits. Okay, common cause of increasing frequency of urinary tract infections. You have a surgery, knee replacement. Maybe you have a back issue. Okay, you take narcotics for a couple of weeks, then boom, all of a sudden you start getting recurrent urinary tract infections. The narcotics are the cause. Diabetic medications. How do we get people's sugars lower? Well, there's a lot of ways, but one way is we help, we force the body to urinate extra sugars. Okay? Sugar plus protein plus water, perfect growth medium for bacteria. Okay? So some people are put on new diabetic meds. Okay? For example, Jardiance is a very common one, and all of a sudden they're getting urinary tract infections. That's the cause. SSRIs. What are those? Antidepressants. Zoloft, Prozac, okay? Lexapro, some common examples. They can increase your risk for urinary tract infections. So if all of a sudden you start getting increased risk for urinary tract infections, we have to look at your medication list as well. Calcium channel blockers. We talked about this the last time when we had our high blood pressure talk. Okay, Norvasc and Lodipine, a very common blood pressure med. It can increase your risk for urinary tract infections. And then the biggest thing, honestly, is if you gotta urinate, go urinate, okay? Don't hold it, all right? That's a big issue, okay? Holding urine for long periods of time has been shown to increase your risk for urinary tract infections. Okay, the classic cranberry pills. Okay, how many have taken cranberry pills in the past? None of you guys? Okay, one. All right. Cranberry pills. All right. Honestly, my personal opinion is I don't think they work. Okay. There are some studies that show that it's supposed to limit the adhesion of bacteria to the bladder wall, hence preventing urinary tract infections. Well, there's a bunch of studies been done on it, and it's all mixed results. Okay. So there's a placebo effect for cranberry pills. Okay, I'm a firm believer in the placebo effect. That's when basically you take a sugar pill and for a reported solution it makes you feel better because of the placebo effect. Well, guess what? If it works, it works. So if you take cranberry pills and it makes you feel better, continue to do it. I will never say no, but understand that I'm not going to give a false promise for something that hasn't been clearly shown to work. Okay. Diet. Diet has a huge impact on urinary tract infections. Okay? So, stay hydrated. We talked about cranberry products. We just talked about probiotics. Okay? Probiotics are like live cultures that are found in over-the-counter supplements. They're found in things like yogurts. There's mixed studies that show that if we can balance your gut flora, it can lead to a healthier immune system. A healthier immune system leads to reduction of urinary tract infections. Fiber-rich foods. The American diet in itself is a very low-fiber diet, okay? Especially with this whole new no-carb craze, okay? So make sure you have your fiber, all right? Bowel movements, having regular bowel movements allows bladder function. So if your rectal vault, meaning your lower intestinal system is filled with stool all the time, that does not allow the bladder to expand and contract appropriately. So that will increase your risk for urinary tract infections. Okay? Processed foods, we all know they're bad for you. Okay? If you eat at McDonald's every day, you're going to increase your risk for infections overall. Vitamin C rich foods, your fruits, so on and so forth. Vitamin C has been shown to help improve the immune system, lower urinary tract infections. Caffeine and alcohol, everything in moderation, okay? I have some patients that drink 8 cups of coffee a day. Patrick drinks 8 cups of coffee a day, my marker, and I always tease him about it, okay? He's got to back off a little bit, or he's going to get urinary tract infections. Protein, okay? Some of people here are trying a keto diet, okay? High protein diet, all right? That can increase your risk for urinary tract infections. What's the number one sign of urinary tract infections in the geriatric population? Confusion, okay? You wake up one day and you can't think as clearly as you used to, all right? That's the number one sign. Change in appetite. Hey doc, I haven't really had any appetite for the last 2 days. First thing that comes to my mind is a urinary tract infection, okay? All right? If I had a urinary tract infection, would I be confused? Yes, but that's not going to be my first sign, okay? Pain on urination, increased frequency, that would be my sign, okay? And that's up there too. Those are all common signs and symptoms, but remember, confusion. So if your loved one, okay, partner, whatever, all of a sudden wakes up confused one day, think about a urinary tract infection as a possible etiology. I can't tell you how many times I get, hey doc, I think my mom is having a stroke. She's not having a stroke, all right? Confusion is not the first sign of a stroke. Okay? Confusion or disorientation is a sign of usually an infectious process in the geriatric population. Okay, I know this slide is busy, all right? But this has to really focus on recurrent urinary tract infections, all right? If you're having three more infections per year, you can potentially fall into the realm of recurrent urinary tract infections. So therefore, we need to treat things a little bit differently. And again, this is all based on kind of the scenario and history associated with these recurrent urinary tract infections. Management is different, okay? All right? Antibiotic choice is different. Duration is different, all right? So, if you find yourself with recurrent urinary tract infections, that means you and I, or a doctor, has to have a detailed conversation with you. The worst thing that happens is that you go to urgent care or ER because, guys, they care, but they don't care about appropriate management. They're just going to throw antibiotics at you, and they're going to send you on your way, all right? They don't care about prevention because that's not their role. You have to understand, an ER doc's mind frame is treat and discharge, okay? Treat and observe, or treat and admit. That's their mentality, okay? All right? They're not there to treat and manage. That's not their role. That's not how they're trained. Urgent care, again, these guys are seeing 30, 40 patients a day, in and out, all right? You have urinary tract infection, urine looks dirty, here's antibiotics, you need either Keflex or Macrobid, boom, you're on your way. Do they care what type? Do they care about the reason why? No, because that's not their job. That's not their role. A lot of times when I have patients that have recurrent urinary tract infections, I'll introduce a low-dose antibiotic for 3 to 6 months, okay, to prevent this from happening again. But remember, I can throw antibiotics all day, people, and if they're not focused on hygiene, if they're not focused on hydration, if they have other medical problems that we're not optimizing or taking care of, we're not going to solve the problem. And what happens is that if I keep on throwing antibiotics at you, you're going to become resistant over time. And then we run into trouble. Yes, I've had 3 patients over the last couple of years that have been resistant to all antibiotics. Okay? Guess what? Then we reach into the doctor's bag and we start choosing highly toxic antibiotics from the 1930s and 40s, okay, to treat these urinary tract infections. Or you go and you start having manual bladder washes, which are extremely uncomfortable to get rid of urinary tract infections. So I've had all these scenarios in the past. So, quick little talk about urinary tract infections. In the future, my plan is to kind of just do these pearls of wisdom, 20 minutes, 30 minutes, nothing longer, open to questions. But it's something to stop by, have a cup of coffee, learn something, and then go about your day. Questions I can answer for you guys at this time.
Do heart palpitations have anything to do with hydration, or not the right kind of hydration? The reason I ask is I get heart palpitations a lot, and I have to take electrolytes 3 times a day.
So yes, so cardiac dysrhythmia, meaning irregular heartbeats, okay? Whether it's the top part of your heart or the bottom part of your heart, are closely related to electrolyte management, okay? So some people are very sensitive to slight changes in things like magnesium or potassium. Those are the 2 main cardiac electrolytes, okay? So having that bolus of electrolytes sometimes is necessary to control your palpitations.
Okay. Thank you.
Other questions?
When you get an infection, and it's the kind where you want to tear the tile off the bathroom wall, and you go to the doctor, and they, take a urine sample, and ostensibly they're going to try to figure out which bacteria you have, but you have to wait and wait and wait, and it is so extremely uncomfortable. There are some things that you can get at the grocery store or the pharmacy. Are those not good to take? Or not?
No, those are okay. Things like pyridium, okay? It's a medication to reduce the burning or discomfort of bladder infections. That's over the counter. Okay?
Yeah.
Another one is anti-spasm medications for your bladder, okay? Because a lot of the pain and discomfort that you're experiencing is spasming of the bladder because of inflammation from an infection. Okay? But also, sometimes the worst pain is when it goes from your bladder to your kidney, called pyelonephritis. Your kidney is surrounded by a web of nerves. Okay? Pain is overstimulation of nerves. Okay? That's what pain is. So when you get inflammation that overstimulates nerves, and your kidneys are surrounded by a whole covering of nerves, so that's why it can be so painful. Okay? The reason why the urinalysis takes so long to process is because, one, it's really up to the growth of the bacteria to show us what's growing. Okay? There are new ways of testing urine, and we've already implemented some of those tests here, where we look at fragments of bacteria that basically kind of hook to a special assay that gives us instant results within 24 hours. Okay? But what also is we have to also wait to see what kills that bacteria. Okay? That can take time as well, depending on genetic markers and resistance pattern. The more resistant a urinalysis is, the longer it takes to come back. Okay? But a lot of times my philosophy is I'll get a urinalysis, and if someone is symptomatic, I will go ahead and just treat with a generic antibiotic until I get that resistant pattern back. Okay? It just depends on patient scenario. Again, I have to be cautious about not throwing antibiotics at everyone with any sort of little sign or symptom.
Well, that's it. I've been able to find things in the pharmacy. It turns your urine bright red.
That's correct. That's the pyridium.
Yeah.
Yep.
But it does sort of help with the pain.
That's correct. So that is designed to help with discomfort associated with urinary tract infection.
Yeah.
That is perfectly okay to take.
And that's okay.
Yes.
Okay.
Other questions? Perfect. I'm going to try these two on a regular basis. Pearls of wisdom. Okay. Quick, 30 minutes, meet and greet, and then I can go back to seeing patients, and you guys can enjoy your day.
Thank
Thank you.
Thanks, guys.
Thank you, Dr. Thomas.